Hello, my name is Brian Clarkmore, and I'm here to talk to you today about the importance of selecting LGBTQ-friendly healthcare. Why is this important? It's actually important for multiple reasons. Primarily, of course, your health, your physical health and well-being, as well as your mental health and well-being. Also, there are other stakeholders in this. Think of your family and your loved ones. Your health and well-being is very important to them also. So, the things that you need to look for when you are selecting a healthcare professional, actually, more than just a healthcare professional, it's anybody that you will be doing business with. Healthcare, buying or selling a car, buying, selling a house, anything else. Do they understand your needs? Are they going to be able to specifically identify what you need, you as an LGBTQ individual? With regard to specific healthcare needs, are they going to understand things like your hormones and STI and HIV testing, the necessity of this, as well as promotion? Are they going to ask you if you want to be tested? Are they going to wait until you ask for testing? Something else to watch for is, how do they ask you about testing? Do they speak to you in a pejorative way, or do they speak to you like you're a human being? Are they going to ask you, do you need testing for your own well-being, or are they going to be offensive when they ask you? Something else that you need to look for is, especially as a gay man or anybody that has sex, are they going to ask you about PrEP? Do they know about PrEP? Many healthcare people don't know anything about PrEP. If you ask about PrEP and they don't know, politely educate them and check for receptivity. See if they're going to be interested in prescribing PrEP for you. In some places, like California, you can now receive PrEP, which is pre-exposure prophylaxis, over the counter. PrEP is actually an HIV medication that you take daily to prevent contraction of the HIV virus. Something else to look for when you are selecting a healthcare professional, especially as a gay man. Are they going to understand anal health? If you have anal sex, you need a doctor that is not going to be afraid to talk to you about this. You're also going to need to find a doctor or a healthcare professional, a physician's assistant or a nurse practitioner that understands drug use and its connection to our culture, how it all works, the connection to sex. They're going to have to know what P&P is. If they don't know, again, politely educate them. And think about, if you have a doctor or a healthcare professional that does not know what you're asking them, and they don't know several things that you're asking them, you might think about finding another one. Also, if you are a trans person, find someone that is a professional that is receptive to doing OBGYN examinations, or can refer you to somebody that will be friendly to trans folks. This is really, really important because everybody needs examinations, and you want somebody that's going to be receptive and understanding, not somebody that's going to do something and not have your well-being in their best, or not think of your best interests. Other things to think about, again, make sure that your professional, the professional that you're seeing, is proactive. An example of this would be someone that has recently lost a partner due to death or separation, divorce. Someone who would say, when you start dating, we'll be ready for that. You may not need PrEP now because you were in a monogamous relationship, but when you start dating, we will address that. That's an example of somebody being proactive. You want to find people that are going to talk to you like this. Also, you want a healthcare professional that's going to make eye contact with you and not talk at you or talk to another place in the room, but actually speak to you. Somebody that is going to understand the stress associated with living as a single LGBT person. Many people don't take into consideration that the life expectancy of somebody in the LGBT community, because of bullying, because of suicide, because of other things, our life expectancy is much lower. And there's also a great deal of stress associated with being single. You need a professional that is going to understand that and is going to look at your health care, again, with your best interest at heart. Do they take time with you? Are they going to rush through things, or are they going to sit with you and learn about your life, learn about what you did before you retired, what you did before you moved, your professional goals, your personal goals? Are you married? Are you single? Are you dating? They really need to know something about your life. Things that happen outside of the doctor's office impact you directly. Things that happen in your personal life determine how healthy you are, how healthy you live, and they need to know about all of these things. And if you have a professional that is not going to listen to those things, chances are they're not going to have your best interest at heart. Are they punctual and not just arriving at work, not just coming to work on time, not just coming into the room on time, but also responding to you? If you have a question or a concern or a need, are they going to respond to you in a timely manner? Or is somebody from their office even going to respond? Sometimes if you reach out to the doctor with a question, the doctor himself or herself may not respond to you, but they may have a nurse or another person in the office contact you. As long as that's done in a professional and timely manner, make sure that when they do contact you, for instance, if you have testing done and they contact you with test results, make sure that they're not going to make you feel guilty about your test results. If somebody does make you feel guilty or says something negative, it is very important that you contact somebody, because that's not what testing is about. That's not what healthcare is about. It's supposed to help you be healthy, not drag you down or make you feel guilty. Is the doctor's office clean? It's very important that when you go in, things are clean, orderly, and ready to help you be a healthy person. There may be moments when things are messy because they're extremely busy. The reception people are frequently multitasking. They're answering phones, they're checking people in, they're doing lots of things at the same time. And they're also frequently tasked with keeping the waiting room clean, and there are other people that are doing multiple tasks, multiple things, including keeping the exam rooms clean. Make sure that things are in order, because that frequently says something about how their business is run. Also, along with that, how are you greeted? How do they respond when you walk into the room? When you go into your doctor's office, the receptionist may be on the phone, they may be checking in other people, but how do they respond when you approach? If you're waiting patiently in line, your turn comes and you walk to the window or the desk, and they should be receptive. They should smile, they should look you in the eye, they should greet you, and be engaging. If they're not, look around and find out why. Are they otherwise engaged, or are they just not friendly or not receptive? Frequently, a doctor's office will have you fill out what's called a PHQ-9 form. This is a form that asks questions about your current mental state. Are you depressed? Are you angry? Are you in a potentially harmful situation at home? These are things that are very important. If they don't ask you with a form in the waiting area, somebody should ask you when they're checking you into the room. Again, the doctor, the healthcare professional, should take a holistic approach to your well-being. They need to know not just how you present in the room, but they also need to know what's going on in your life. If you are in a potentially harmful situation, they need to know about this. They can help you. They can connect you to services that will help you with this, help you deal with this. They also need to know if you are potentially depressed. They can connect you with someone that can prescribe medication or other forms of therapy that will help you deal with your depression, your anxiety, or any other condition that is affecting your health at that point. Also, look for somebody that's going to wash their hands. This is very, very important. Many things that healthcare professionals come into contact with in their offices, in their work environment, are potentially contagious. You don't want somebody that's going to walk into the room and shake your hand after having shaken the hand of someone with the flu, because they probably just gave you the flu. They need to wash their hands before they touch you, as soon as they walk into the room, and they will probably wash their hands again before they leave. This is not them saying you're a dirty person. This is them taking your health into account. As a patient, you also have some responsibilities. You need to be prepared when you visit the doctor's office or when you see your healthcare professional. And again, this is like buying a car. You need to know kind of what you want before you set foot on the lot. When you see your primary care physician, when you see your psychiatrist, when you see your nurse practitioner, you need to know why you're going in. If you are not feeling well, you need to think about exactly how you are feeling. Take notes. Write some things down if you need to. If you are forgetful, write it down. Most doctors and nurses will not object to you having a list and talking to them about your bullet points, talking to them about the things that are your concerns at that time. Contact your insurance company and keep your PCP information, your primary care physician information, current. If their phone number changes, if their address changes, if you change primary care physicians, all of this, it needs to be noted with your insurance company. Communication between your insurance company and your healthcare providers is very important. Also know what's covered by your insurance company. You can talk to your insurance company and talk to your primary care physician or your other healthcare provider and find out what they're doing, what's covered, what kinds of blood work are covered and testing, and do you require a referral to see another kind of provider. Also, be sure to arrive early. Punctuality is important from your perspective when you're looking for a healthcare provider, but you also need to be on time. If you are going for a physical or just a regular appointment, be 15 minutes early at least. If it's your first visit, arrive 30 minutes early. That's just good form. They will have things for you to fill out, paperwork. They may have questions. The doctor may want to spend extra time with you, or the nurse practitioner if it's your first visit. Again, this is all good. They need this time with you to find out exactly who you are and what your needs are. Also arrive clean and well-dressed. Just clean clothes, take a shower, do what you're capable of on that day. This, believe it or not, does impact the kind of care that you receive, the quality of care you receive. If somebody, especially a healthcare provider, they deal with lots of sick people every day. If they walk into the room and they feel that, you are not taking care of yourself, that does affect how they perceive you. You want to put your best foot forward, whatever you're capable of that day, and tell them, this is what I'm capable of today. If you're really sick, let them know. I was so sick I couldn't get out of bed today. I had trouble getting dressed. I had trouble showering. That's very important. Those are called activities of daily living, and they need to know if you're having trouble accomplishing these things, then that you're severely limited on that day. They need to know that. Also, have a list of your current medications and the dosages. how many times per day you take them, how much you take, when you take them, and what you take them for. This is very, very important. Frequently you will be prescribed a medication that one physician or one healthcare professional might prescribe for one condition, and you're taking it for something else. It's important that you let your doctor know that. Sometimes, for instance, with PrEP, doctors may not understand PrEP. They may not understand pre-exposure prophylaxis, and they may jump to conclusions and say, oh, well, you're HIV positive, but you're not HIV positive. You're taking a preventive medication. They need to know this. Let them know, again, how often you take it, what time of day you take it, and the strength of the medication that you're taking, the dosage. And make a list of questions and concerns. Again, this is with regard to how you're feeling and what you want to talk about. Frequently when you get in the doctor's office or in the exam room, you forget. Things happen and there's sometimes a lot going on. Have your list of bullet points, things that you want to cover. You want to ask them questions like, especially if it's a first visit, are they from there? Do they, where did they go to school? You also want to know some things about them. Are they married? Or what kinds of relationships do they have? Because they might be LGBT also. If not, you kind of want to know something about their personal lives. If nothing else, is a conversation point. If they have kids, a lot of people will tell you. They will talk to you. Oh, I have kids, or I have nieces and nephews, grandchildren, whatever. Those are things that you can talk about. Very often they like to be appreciated as people also. You also want to know where they studied, what kind of doctor they are. If you've done your homework, you will probably know this beforehand, but sometimes you don't have the opportunity to. If it's a walk-in clinic or an emergency care clinic, you may not have an opportunity to talk to them a great deal, and they may not know you well, but you still want to talk to them. Find out a little bit about who they are. Reception, again, how you're received. It's very important for you to look at not only what kind of work they're doing, but what kind of work are you doing? When you walk in, are you presenting with are you open? Are you friendly? Do you smile? Sometimes when you're feeling really bad, that's really difficult. Do your best. Do what you're capable of. And again, tell them, I'm sorry, I'm not feeling well. Let them know how you're feeling. Chances are they're empathetic and they will understand. If you walk in and you present to them with a bad attitude, chances are that's what you're going to get in return. And the reception people, they're the gatekeeper for the healthcare professional. So you want to address them in a friendly manner because they can frequently control how much contact you have with your healthcare professional. They might be the appointment person. They might be the person that when you're feeling really sick and you call, they can say, oh, well, let me talk to the doctor, or let me talk to them and see if we can squeeze you in because you sound awful today. So you want to be friends with these people. You don't want to walk in and have a bad attitude because somebody cut you off in the parking lot. That happened outside. Don't bring that inside. Also, make sure that you read the summary that they give to you at the end of your appointment. If you don't get a summary, ask for one. This is very important because this is kind of, it's a summary of the visit that you had this time, but it can also be a prompt for your next visit. They may have information about blood work that you need to have done before your next appointment. There may be information about your medications. You need to look at that, make sure it's all correct. If it's not, you need to notify your provider and let them know, your healthcare provider, let them know this is incorrect. That's very important. Again, that's part of your responsibility as a good patient. When they take your vital signs in the room, ask them, what was my blood pressure? What was my temperature? Know these things. That way you know what your regular blood pressure is. If you have been, let's say you were in traffic and you were excited or agitated, that will affect your blood pressure. Let them know, oh, my blood pressure is high today, or it probably will be high. If you don't know what your blood pressure is, what your normal is, you need to find out. That way, when they say, oh, well, your blood pressure is high, you need to know what that looks like. You also need to have an emergency contact. There needs to be information on all of your paperwork for somebody that you talk to when you need something. You also need to have somebody that can potentially advocate for you. I believe they call it a proxy or a power of attorney, in case something happens that you're nonverbal. This is very important because sometimes if you're in an accident or if something happens that you can't speak, somebody that knows you needs to be able to be your voice for healthcare and other things as well. And don't be afraid to advocate for yourself. If you feel that somebody, a healthcare professional, has said or done something that you are not happy with, talk to them about it. It's best to speak face-to-face with them. If you can't, call or write an email. And if you don't get the response that you like, don't be afraid to pursue that. Again, this is your health that is at stake, your physical health, your mental health. Also, this is something that's important to the others in your life, those that are important to you. You can frequently go to the director of operations and they will be able to, if you can't have it resolved at a lower level, they should be able to give you some resolution. If nothing else, you can call your insurance company and they will talk to you about what is necessary to change healthcare providers. This is kind of a last resort. This is something that you don't want to do frequently because continuity of care is very important. So keeping the same healthcare provider for as long as possible and having somebody that knows you and knows your situation, again, knows your personal life, this is very important. And last but not least, I encourage everyone to have a will. So find a legal professional that can help you with that. So that's pretty much everything I have for that. But I hope it's just been enough to prompt you and make you think about things. Again, having somebody that understands you, understands your needs, that's very important. It's your health care, and there are people that love you that want to keep you around for a while. Thank you.